Hello, English learners. Welcome back to the channel. My name is David. Today, I will share with you my daily routine as a doctor. I will speak slowly and clearly so you can follow and understand me. You will also learn useful words and expressions for daily life. Ready? Let's begin. I usually wake up very early, around 6 a.m. My alarm rings and I open my eyes. Sometimes I feel like sleeping more, but I know I have an important job to do. People depend on me. I stretch my arms, sit up in bed, and take a deep breath. Then I get up and go to the bathroom. In the bathroom, I brush my teeth carefully. I wash my face with cool water to feel awake. If I have enough time, I take a quick shower. Then I look in the mirror, fix my hair, and smile. It helps me start the day with positive energy. After that, I go to the kitchen to prepare my breakfast. I usually eat eggs, bread, and sometimes fruit. I always drink a cup of coffee or tea. Coffee helps me feel more energetic in the morning. While I eat, I check my phone. I look at the news, the weather, and sometimes my messages from the hospital. After breakfast, I get dressed. I usually wear formal clothes because I change into my white coat at the hospital. I check my bag to make sure I have my phone, my notebook, and my ID card. Around 7 a.m., I leave the house and drive to the hospital. The road is sometimes busy, but I enjoy listening to the radio while I drive. When I arrive, I greet the security guard and enter the hospital parking lot, where I park my car. Before I walk to my office, I go to the hospital locker to put on my white coat and prepare for the day. At 7:30 a.m., I begin my morning round. This means I visit the patients, check their health, and talk to them. I listen to their heartbeat with my stethoscope. I measure their blood pressure and ask them how they feel. Some patients need new medicine. Others just need a kind word to feel better. I always try to smile and give them hope. After the round, I go back to my office to write reports. I also check my schedule. Sometimes I have appointments with patients who come from outside the hospital. I listen to their problems, examine them, and write prescriptions. At 12:30 p.m., I take a lunch break. I usually eat in the hospital cafeteria. The food is simple, like rice, chicken, or salad. Sometimes I bring a sandwich from home. I sit with other doctors or nurses. We talk about work, patients, or even family life. It is nice to relax for a short time. After lunch, I continue my work. In the afternoon, I may visit new patients, review test results, or discuss treatments. Sometimes emergencies happen. A patient arrives in pain or in a critical situation. In those moments, I must act quickly and carefully. I work with the nurses and other doctors to help the patient. My job can be stressful, but saving lives is the most important thing. At around 4 p.m., I often attend short meetings. We discuss patient cases, new medicines, or hospital updates. Then I return to my office to finish my notes and prepare for the next day. Now, let's step into the operating room. Have you ever wondered what all those shiny tools are for? We are going to learn the names and uses of common surgical instruments. There are 3 categories of surgical tools. Let's get into it. The first category of tools is cutting and dissecting instruments. We use it to cut skin, tissue, and suture. The first tool is the scalpel. It is the primary tool for making the initial incision or cut into the skin or tissue. It's incredibly sharp for clean, precise cuts. The second tool is the surgical scissors. We use it for cutting tissue, stitches, or bandages. They come in many shapes. The third tool is the saw. We use it in orthopedic surgery to cut through bone. The second category of tools is grasping and holding instruments. We use it to hold tissue, bones, or surgical materials. The first tool is forceps. It is a versatile tool used for grasping, holding, or manipulating tissue. Think of them as very precise locking tweezers. The second tool is needle holder. It's a special type of locking forceps designed to hold the suture needle securely while the doctor sews up the incision. The third tool is retractors. It's used to hold an incision open, to pull skin and tissue aside so the surgeon can see and access the area to operate on. The fourth tool is clamps, used to close off blood vessels or hollow organs to prevent the flow of blood or fluid. The third category is other essential tools. There is surgical needle and suture. The needle is used to carry the suture, the medical thread, through the tissue to close a wound. Suction device, or suction tip, is used to remove blood, saliva, and other fluids from the surgical site to keep the area clear for the surgeon to see. Cautery, or electrocautery, is a pen-like tool that uses heat or electricity to burn tissue. It is used to cut tissue or to seal or cauterize blood vessels to minimize bleeding. These were the usual and essential tools that we use in the operating room when we have a surgery or an operation. Now, let me tell you about the rest of my day. I usually finish work at 6 p.m., but sometimes I stay later if patients need me. When I leave the hospital, I feel both tired and proud. It is not easy to be a doctor, but it is a meaningful job. When I arrive home, I take off my shoes and change into comfortable clothes. I usually wear a soft t-shirt and pants. I rest for a few minutes on the sofa. I drink a glass of water and breathe deeply. After a busy day, I enjoy a moment of peace. Around 7:30 p.m., I prepare dinner. If I am not too tired, I cook something simple like pasta, rice, or soup. Sometimes I order food if I want to save time. While eating, I avoid looking at my phone. I like to focus on the meal and enjoy the quiet. After dinner, I spend some free time. Sometimes I watch a TV series or a documentary. At other times, I read medical articles to stay informed. If I feel tired, I just listen to music and relax. At 9:30 p.m., I take a few minutes on the balcony, and I call my family or friends. We talk about the day's events, the updates, weekend plans, and stuff like that. Talking with them makes me feel happy and connected. At 10 p.m., I get ready for bed. I brush my teeth again, wash my face with warm water, and put on my pajamas. Before sleeping, I sometimes read a few pages of a book. It helps me calm down and forget the stress of the day. I also think about my patients. Did I help them? Do they feel better now? What can I do better tomorrow for them? These questions stay in my mind, but they motivate me. Finally, at 10:30 p.m., I turn off the lights, lie down in bed, and close my eyes. The room is quiet and peaceful. I breathe slowly and fall asleep. I know tomorrow will be another busy day, but I am ready. And that is my daily routine as a doctor. I hope you learned new words and expressions that you can use, especially if you are a medical student. Thank you for listening, and goodbye.